You said every black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented.
RFK Jr. is the Secretary of Health and Human Services, responsible for the health policy of 330 million Americans. In a 2024 podcast, he suggested black children on ADHD meds should be reparented, taken from their families. Now, Rep. Terri Sewell is reading his own words back to him. Let's watch.
Mr. Secretary, you've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that black children on ADHD medication should be reparented. You said every black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board-certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a black child?
I don't even know what that phrase means, and I doubt that
a yes or no
it.
answer.
I doubt that I said that phrase. No,
absolutely
I'm not going to answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be clear,
it doesn't make any sense. I don't even know what it means.
I don't either. That's why I'm asking.
And by the way,
so to be clear, you're not a doctor, you have no medical degree, and you have no formal medical training. You have never parented a black child.
24 of the 26 HHS secretaries have not had medical degrees.
This is my time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a black child, and yet you are suggesting that the federal government should take black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based
You're just making stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a black child who has been on ADHD or ADD?
I don't even know what you're talking about, Congressman.
I
don't know what you're talking about. I don't know what reparenting even means.
I don't either, but you said that.
I did not say that.
Mr. Secretary, for black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating black children from their families. During slavery, black children were taken from their parents and sold with no regard for their humanity. And after slavery, black families continued to face forced separations through Jim Crow laws, discriminatory policing, and child welfare systems that too often assumed that black parents were unfit. Even today, black children are removed from their homes at higher rates than white children, not because of their greater harm, but because of longstanding bias and built-in institutionalism. For you to suggest that black families are not capable of raising their own children is deeply offensive. Sir, you are the Secretary of Health and Human Services for the world's most powerful country, and your words matter. When you suggest that reparenting black children, when you sow doubt about the safety of vaccines, and when you promote unproven statements that have no basis in science, you endanger the lives of everyone across this nation. Those children have parents, and to suggest that they have to be reparented is offensive.
I never suggested that.
Your words matter. When those words are careless, communities pay the price. When your words are imprecise, they create confusion. And when your words are dismissive, they cause real harm. So you don't have the pleasure, because of your position, to speak first and think later. Not in this job and not
Pointing
because
at
of your
something I
responsibility.
supposedly said in
expect, and
2014.
the American people expect, that you choose your words with sincereness and with seriousness, the seriousness that your position demands. American lives are at stake, and it's time that you start acting like it, sir.
Okay, let's break down everything that just happened, because there is a lot to unpack here. Let's start with the denial. Rep. Sewell read a direct quote, word for word, from a 2024 podcast that RFK Jr. himself recorded. And his response was, "I don't even know what that phrase means. I doubt I said that. I'd like to hear the recording." That is not a denial. That is a stall tactic. A real denial sounds like, "I never said that, and here is the full context." What we just watched was a man hoping the question would disappear if he acted confused long enough. And here is the thing. The recording exists. Rep. Sewell had the transcript in her hands. You don't get to sit in front of Congress and pretend your own words never happened. Now let's talk about the credentials. Rep. Sewell made a point of establishing 3 things on the record before she even got to the substance of her question. 1. RFK Jr. is not a board-certified physician. 2. He did not go to medical school. 3. He has no formal medical training whatsoever. And she asked him directly, "Have you ever parented a black child?" He couldn't even answer that. Why does all of this matter? Because this man is the Secretary of Health and Human Services of the most powerful country on earth. He is making decisions about what medications your children take, what treatments get funded, what science gets trusted by the federal government. And he cannot defend a statement he made about child psychiatry because he has absolutely no foundation to stand on, medically, scientifically, or personally. Then there is the actual content of what he said. Think about what reparenting actually means in practice. It means taking a child away from their family, placing them somewhere else under someone else's care. And RFK Jr. applied this idea specifically to black children on ADHD medication. Not children in general, not all medicated children, black children specifically. That is not a policy position. That is not a medical recommendation. That is a man with enormous institutional power casually suggesting that black parents are not capable of raising their own children. And that brings us to the moment that hit the hardest in this entire exchange. Rep. Sewell didn't just push back on a bad quote, she put it in its full historical context, and that context is devastating. The separation of black children from their families is not a hypothetical concern in America. It is not an abstract talking point. It happened under slavery, where black children were sold away from their parents with no regard for their humanity. It continued under Jim Crow through discriminatory policing and child welfare systems that assumed black parents were unfit by default. And it is still happening today. Black children are removed from their homes at significantly higher rates than white children, not because of greater harm, but because of systemic bias that has been built into American institutions for generations. So when RFK Jr. sits in a podcast and casually floats the idea that black children need to be taken somewhere and reparented, whether he remembers saying it or not, those words do not exist in a vacuum. They land on top of 400 years of history. And a man in his position should know that, or at the very minimum, he should be willing to take responsibility for it. But here is what might be the most damning part of this entire exchange. He never actually answered a single question, not one. He didn't explain what he meant by reparenting. He didn't apologize for the confusion his words caused. He didn't offer any clarification about what policy he was actually proposing. He denied, deflected, talked over Rep. Sewell, complained about his time, and waited for the clock to run out. That is not accountability. That is someone who is used to never being challenged. Rep. Sewell said it best at the very end. You do not have the luxury of speaking first and thinking later. Not in this job, not with these stakes. The Secretary of Health and Human Services does not get to be careless with words, because when he is careless, communities pay the price. When he is imprecise, it creates confusion that costs lives. When he is dismissive, real people suffer the consequences. American lives are on the line, and what we just watched was a man who either does not understand that or simply does not care.